Hi, everyone. Thank you so much for joining our This is Public Health Graduate Fair. It's really wonderful to be here. My name is Alicia Piate. I'm the Engagement and Recruitment Coordinator here at ASPPH. Like I said, I'm really excited for this webinar. We've got some really great schools and programs here presenting for you all. So let's go ahead and just get started. So first, I want to let you all know that we will have the Q&A portion for the last 15 minutes of our first hour. So please feel free to leave any questions, comments you have down in the chat. Our presenters will answer them if they're directly related to their schools and programs, but any general questions we have, we'll wait till the end and answer them during our Q&A session. I also want to let you all know that you can edit the format of this webinar, aka who you'll see on screen during the presentation. So here are some advice, some recommendations on the screen right now, as well as some instructions. So I'll give you all a second in the event that you want to use these features and hide some of our participants here in the meeting. And so, as I mentioned, we do have a wonderful list of schools and programs here with us today. On the screen, you will see the order as well as those presenting. I think it's really going to be great. It's going to be wonderful. And so to not hold things up further, let's go ahead and get started and introduce our first school, CUNY Graduate School of Public Health and Health Policy.
Hello, everyone. Share screen. Hi, everyone. My name is Meg Krudish. I am the Director of Admissions at the CUNY Graduate School of Public Health and Health Policy. We are located in New York City in Upper Manhattan at 125th Street. This is what our beautiful campus looks like. We have 4 floors in this building right here on the left. We are a relatively small school, about 950 students total. Most of them are Masters of Science students. Okay, so here's an overview of the programs we offer. We have 3 doctoral programs. All of those are in person. We have 5 Masters of Public Health programs. You can do them either fully online or in person, or mix and match and do a hybrid program. 4 Masters of Science programs, they're mostly all fully online, and 3 advanced certificate programs. Okay, so our 3 doctoral programs are listed right here on these 3 concentrations. We actually have our PhD open house this evening, so check out our website for our admissions events if you are interested in our PhD programs. GREs are required for most of these programs, except epidemiology, which is making the GREs optional for this year. There's a listing of our 5 Masters of Public Health programs. None of them require the GREs except epidemiology and biostatistics. That's the only master's program we offer that requires the GREs. And I mentioned earlier that those programs are either fully online or in person, or you can kind of mix and match. If you enroll in the fully online program, regardless of where you live, you are charged in-state tuition. And you'll see what the differential is in a second. Here's a listing of our Masters of Science programs. Most of them are entirely online, except this industrial hygiene program, which is can also be taken in person. No GREs for any of these programs. Okay. And our 3 advanced certificate programs. The great thing about this first certificate program is that you could do the 5 core courses and then transfer any of these courses to any of our master's programs and not lose any time or money. Okay, we offer a flexible schedule. I already mentioned that we have online programs. Most of those courses are in the asynchronous format, so you don't have to sit in front of a computer at any specific time and you're charged in-state tuition. We also offer in-person programs. Again, if you are more comfortable being in a classroom in front of a professor, maybe that program is more suitable for you. Those courses are offered in the evenings because we realize that a lot of our students work during the day or take care of family members. Those courses are 6 to 10 p.m. usually in the evenings. And we offer part-time or full-time options. So you can take 1 course per semester or maybe 4 or 5 courses per semester. It's entirely up to you. Okay, so a little bit about the cost of attendance I mentioned. If you are a New York State resident, or if you are doing one of those online only programs, you're charged in-state tuition, and that is about $26,000 for the entire MPH degree. as compared to out-of-state students, which are $42,000. So it's really a very affordable degree. But we also help you with your tuition, and I'm going to show you the next slide what the scholarships are. But a little bit about the application process. We accept applications for the spring and fall semesters, so you can start as early as this January 2022. And the deadline is December 1st for the spring semester and March 1st for the fall semester. Okay, scholarships I mentioned, we have 3 types of scholarships listed right here. I'll put a link in the chat to our scholarship page where you can find out a little bit more about these scholarships for MPH students. And I know I only have a minute left. And so we'll just talk for like 30 seconds about our application process. It's pretty standard. The way most schools of public health have their application process. We require the SOFIS application, so you must apply through SOFIS for the MPH program and SOFIS Express for the certificate programs. We require at least a 3.0 GPA, 2 letters of recommendation for our MPH program, 3 letters for the PhD program, a resume and a personal statement, and GREs if that program requires them. Okay. I'll be here answering your questions, so please stop by my chat room. Thank you.
Thanks so much. So next up, we have East Tennessee State University College of Public Health.
All right, hey everybody, my name's Jared. I'm the recruiter for the College of Public Health at East Tennessee State University. I'm going to do a quick run through of our master's certificates and doctoral programs, talk a little bit about the requirements and some of the benefits with those as well. All right, so the graduate program, the MPH, we do offer an MPH completely online or on ground except for environmental health. We have a master's in health administration as well. That's completely online or on ground. And we do have an executive track, which I'll talk more about that if you come into this session with me, but it's for students that have background in health administration. And then we do offer a DRPH in those 3 concentrations there, epidemiology, community health, and health management and policy. All 3 of our graduate programs don't require a GRE. Matter of fact, it's not even reviewed for the DRPH. So if you want to beef up your resume for the MHA or the MPH, you can submit your GRE if you're on the borderline with your GPA scores. So as mentioned, no GRE. We do go through the SOFIS application for all 3 of these programs. The GPA requirement for all of them is 2.75 on a 4.0 for domestic applications and a 3.0 on a 4.0 for international applications. Personal statement, 3 rec letters, and then official transcripts. All of this goes through the SOFIS application, and you can see our different deadlines here. The deadlines, just to sum it up in one word, all the online deadlines are the same for international and in the state students, but they do differ for on ground as well. A couple of our graduate certificates, all of them are online or on ground except for rural health. A little bit lower GPA for domestic applications, but still a 3.0 for international. 3 rec letters, personal statement, and official transcripts. But you will be applying through the graduate studies page through this instead of SOFIS. And then our benefits, we do have applied practice experience or an internship. We have 5 research centers within the college. We do offer graduate assistant positions and tuition scholarships. I can jump more into those a little bit if you come into our session. Both of them cover tuition, but the graduate assistant position offers a stipend to live off of, and you can work in any department throughout the university, including our college. And we do offer a Coverdale Fellowship Program for returning Peace Corps volunteers. Lastly here, our contact information. You can reach out to Ryan Youngblood for the MHA program, Jenny Hunt for the MPH program. DRPH, you can reach out to Debbie Slauson, and then you can reach out to me for any general questions. If you do have any general questions that you want to get in touch with somebody else within our department about research programs, if you get stuck, just reach out to me with my email or my phone number there. And then Kurt Meyer down there is for environmental health. They're kind of a close-knit department. So if you want to reach out to them and talk a little bit about their research, you can as well. But that's pretty much concludes my presentation for the College of Public Health at East Tennessee State University. Up next, I believe, is New York Medical College School of Health Sciences and Practice and Institute of Public Health.
Okay, great. Thank you so much. Sharing my screen here. Okay, hi everybody, and thank you so much for joining us today. This is New York Medical College School of Health Science and Practice. My name is Nick Sekis. I'm the Director of Recruitment at NYMC, and there's my contact information there, and I hope to speak with some of you a little bit more in the breakout sessions. So a little bit about NYMC. We were founded in 1860. We share our campus with Westchester Medical Center, which is in Valhalla, New York, which is about 20 miles north of New York City. We have 3 graduate schools within our umbrella under New York Medical College: the School of Health Science and Practice, Basic Medical Science, and School of Medicine. Like I said, our campus is located near New York City, New Jersey, and Connecticut, so we're kind of centered in the tri-state area. And there's a few shots of our beautiful, safe, and suburban campus in Westchester County. So why NYMC? We have small class sizes and excellent teacher-to-student ratio. We're a small independent health sciences school and part of a large university system. So NYMC, as I mentioned, has the 3 divisions within it, but we're also a part of Touro College and University System, which is a international university system that has many, many degree programs, not only in healthcare, but across the board. Our programs are designed to fill demand for graduate school professions. We have a high employment rate and career opportunities amongst both our on-ground and online students. And being in the tri-state area and the New York area, we have a diverse student body population, both of age, ethnicity, gender, and varying work experiences throughout our public health programs. So what do we have? So we have our Master of Public Health, our MPH program, which is a 43 credit program. It has 4 concentrations that you can choose from: health, behavior, and community health, epidemiology, environmental health science, and health policy and management. As of right now, all of these programs are offered in an online format. Due to the pandemic, we moved all of our programs to online only. Although we were operating many of our programs in an online format pre-COVID. Moving forward, you can utilize these degree programs in both a hybrid format or a traditional on-campus format as well, in addition to our online component. In addition to our MPH program, we also have a number of advanced certificate programs that range between 15 and 27 credits, depending on which program that you're more interested in. And I'd be happy to talk more in depth about those in the breakout sessions, depending on the interests you may have in them. In addition to our MPH, we have a MS in Biostats, which is also a 43 credit program. We have a DRPH, Doctor of Public Health program in Health Policy and Management. We also offer several dual degree programs within our school, an MD MPH dual degree program, and also a DPT MPH program, which I'm again happy to talk more about later on, as they are very specific to student interest. So admissions requirements, very similar in some of the other schools we've heard from already. You would apply through SOFIS, through our SOFIS system for both the MPH Advanced Certificate and DRPH program, as well as Biostats. We require a bachelor's degree, minimum 3.0 GPA. Now, if your GPA is below that, we do look at the application holistically, so it doesn't flag an automatic rejection if your GPA is a little bit below 3.0. We do look at your work experience in your healthcare setting, and your recommendation letters, your personal statement, and your resume. We do not have a GRE requirement for the MPH program. The DRPH is also optional for the GRE. As I mentioned, you apply through SOFIS. We do also have tuition discount programs available, depending on your undergraduate institution. If you work for any sort of county or federal health department, we do have a discount program through the FDA and the HHS for our MPH program, and I'd be happy to talk more about that as well. And depending on where you're coming from in terms of your undergrad, we do have some early accept and articulation agreements with many colleges that I'd be happy to speak with you as well about. What else? That's it. So again, thank you so much for joining us today, all of our schools here. We hope you enjoyed the program, and I'm going to send it over to University at Albany School of Public Health.
So let's go. Okay, so my name is Caitlin Reed. I'm the Assistant Dean for Admissions and Student Affairs here at the University at Albany, and I'm delighted to have you all here. So the University at Albany is located in Albany, New York, which is upstate New York, about 2.5 hours north of New York. It's New York City. It's the capital of New York State. We have we offer both an on-campus and an online MPH, but we do also offer basic research degrees, MS, PhD, a DRPH, as well as several advanced graduate certificates. We are structured into 4 academic departments: biomedical sciences, epi and biostats, environmental health, and health policy management behavior. We have an extensive focus on experiential learning through internships and research. And in fact, we have the most extensive public health internship program in the nation. We have a very extensive research portfolio, which provides you with a lot of opportunities to engage in research across both the MPH and the basic research degrees. And as a state school, we are one of the most affordable schools of public health in the nation. So we're about $30,000 for an MPH compared to 60, 70, 80, 90,000 for other schools. One of the distinct advantages that our school provides is that we have a very unique relationship with the New York State Department of Health. We are in a direct partnership with them. Many of their professional staff are actually on our faculty, teaching in our classes, overseeing your research and your internships. You also have direct access to databases. You get your hands-on experience. You get to network. You get that real world collaboration with the state health department. And this collaboration is shown in exactly how we partnered with the New York State Department of Health on COVID-19 through a variety of things, such as drug trial studies, contact tracing, communication plans, etc. And this is, of course, in addition to our full-time faculty. We're a very diverse community. We have both an undergraduate and graduate programs, and in our graduate program, 22% of our students are underrepresented minority students. Another 12% are actually international, and within that population, we have 34 different countries represented, so it's a very diverse population. Our job outcome is excellent. You can see from here that our graduates go on to work in the field. And that is, could they not see my screen before? Okay, so I just saw the chat for that. So we at UAlbany, we have 6 areas of concentration in our online program. We have a fully online MPH. You can complete the Peace Corps, satisfy your internship. We offer several dual degree programs. You can also get a certificate in public health fundamentals, where all the credits are transferable to the MPH, and you can also complete an advanced graduate certificate, and you can double count those credits with your MPH. So we're 51 credits. It's 42 credits of coursework. It's 9 credits of internship, which is 720 hours. You can waive some of it based on prior public health work experience. And that internship is what makes us truly unique. The nationwide average is 300 hours. We provide you with a list of internships that you can choose from, a network where we work closely with other people to make sure that you have placements in internships. 70 to 80% of these internships are funded. I know this is a lot of information. We have a Center for Global Health that provides a lot of international opportunities. And our tuition is very reasonable. So it's less than $30,000 for a New York State resident. Our admission requirements is pretty basic: social science, math. There's science required for your scientific MPH. Our minimum GPA is 3.0. We do not require the GREs. We do review applications holistically like the prior schools, so we will definitely look at everything in your application. Our deadlines are January 15th if you want to be considered for one of our scholarships. We continue to accept after that. That's for the on-campus program. And for our online programs, we have rolling applications for fall, spring, and summer. We admit in a limited number of concentrations for spring. And I know that was a ton of information. So I really hope that you'll join my breakout room and we can talk more about what we offer as the program. And so next up is the University of Illinois in Chicago.
All right, thank you, Caitlin. My name is Brandon Seeloff. I am the Assistant Dean of Recruitment and Admissions for the UIC School of Public Health, University of Illinois at Chicago. Thanks for joining us today. Happy to talk a little bit about our school and programs. I'll start by just letting you know a little bit about where we are. So we are located in the heart of Chicago. We're about 1.5 miles from the downtown Loop area, and we are in the Illinois Medical District, which is the largest urban medical district in the country. And we're also on the UI Health campus. So UIC does have a full range of health science colleges. We have medicine, pharmacy, dentistry, applied health sciences, a full range, and there are a lot of opportunities to work interdisciplinarily with both those schools at UIC and all the hospitals in the area. So also within a few blocks are Rush University Medical Center, Cook County Stroger Hospital, the UI Health Hospital. So there are a lot of opportunities as a student to work with all of those different health sciences. We are a public state-funded institution, so we are very engaged in the community and really try to impact the health of those around us in Chicago. We also have a collaboratory for health justice, so we do try to really engage the community in our research. We have about 120 faculty members, and that group works to make sure we're really engaging the community as we do research at the school. And we celebrated our 50th anniversary last year in 2020. So we are very well established in the public health community, both in Chicago, state of Illinois, and nationally as well. This is our full range of degree-seeking programs. I won't go into full detail on all of these, but just to give you a picture of us as a full school of public health, the MPH, the MS, and the PhD are offered by all of those different academic divisions you see on the right. And then we have the 2 standalone degrees, the MHA, the Master of Healthcare Administration, which has some public health components, and then a lot of business and finance focused coursework as well. And our DRPH, which is a fully online program focused in health leadership that's really designed for mid-career public health professionals looking to take on higher level leadership roles. These applications are all through SOFAs, like a lot of other schools you've heard, and it is a full holistic review process. We are GRE test optional for this application cycle. We're staying optional for the 2022 cycle, so it is not required for any of these programs. We do also have a global health program. You'll see a lot of schools offer it as a standalone MPH. We have it as a concentration that you can add to any of those master's degrees. So you apply for any of the MPH programs, and then during your first year in the program, you can add global health. There's a set of courses you take primarily in the second semester and second year. Most students do choose, a lot of students choose to go abroad for their applied practice experience in the global health program. Last year, unfortunately, that hasn't happened as much, but we do hope to reestablish a lot of those relationships, but students do complete a global applied practice experience in the global health program and prepares for a variety of careers. Just a little more about UIC as a whole. We are, like I said, we're one of the most diverse institutions in the country, top 20 in Chicago's most diverse institution. Like I said, we're about 1 mile, 1.5 miles from downtown Chicago. So there are a lot of opportunities there. As a state institution, we do try to keep tuition as reasonable as possible. Wall Street Journal ranked us as number 8 best value in education. We're top 25 research institution. School of Public Health is actually the second largest research school at UIC behind the College of Medicine. So there are a lot of research and opportunities if you're looking for those, but then we do try to help students fund their education as much as possible too. And then just want to touch briefly again on that UI Health campus, that when we talk to our students coming in, the #1 reason they tell us they choose UIC is our location, both in Chicago, the urban setting, and then the access to all of those resources just a little bit outside our doors. So there are a lot of opportunities as a student, both within the school and then at the university as well. Like the others, I do strongly encourage you to attend breakout session if you can today. We will also be hosting some upcoming information sessions at the school that are all online as well, so you can register for those through our website, and I'll provide my contact if you join us in the breakout. So thanks for joining me. I'm going to turn it over to Dan from the University of Minnesota.
All right. Well, good morning, good afternoon, wherever you're joining us from. Thank you for hanging out. And I'm glad to be towards the end because I like to echo a lot of the things that everybody else has said. So we'll be real brief here. I'm Dan Chang. I'm the Associate Director of Recruitment and Admissions at the University of Minnesota School of Public Health. And just to give you a little bit of the lay of the land of where we're located, we are located right in between the metropolitan areas of Minneapolis and St. Paul. Located on the East Bank of the Twin Cities campus. It's a very wonderful area for us to be a part of, in terms of our community. We have one of the most diverse and rich cultural communities in the country. If they say if you put a pinpoint in the middle of campus in a 2-mile radius around, there are more languages spoken in this 2-mile radius than anywhere else in the country. So very proud of that and in how we incorporate our academics with the community. We're also very much a urban metropolitan commerce community with world headquarters of Target, 3M. We have the Mayo Clinic just about an hour south of us in Rochester. And then we're also really connected to our political community, being just a couple miles away from the state capitol. So I find the best way to kind of describe our school is to break out information about our various divisions. We have 4 divisions that make up the School of Public Health. And so you'll see here on the screen all the different program areas and degrees within each of those divisions. But the Division of Epidemiology and Community Health focuses on disease and health in various populations. Our faculty and students examine the distribution, cause, and prevention of diseases and how human behavior affects overall health. So you see here various programs. In our Health Policy and Management Division, students will learn from faculty who are reshaping and improving the rapidly changing healthcare environment, from influencing access to care to determining how a healthcare system is structured. Policy and leadership play a central role in public health and programs. Our public health and programs in this division will prepare you to be a leader in that field. The Division of Environmental Health Sciences focuses on environmental and occupational health concerns, from investigating hazards in our environment to establishing the basis for public health policy. And then finally, our Division of Biostatistics focuses on the development of statistical methods for biomedical research. Through this division, we collaborate with university research partners on projects involving HIV/AIDS, heart and lung disease, cancer, neuroimaging, and many other clinical disciplines. And new for many students, we are launching our brand new Masters of Public Health and Public Health Data Science. So this is a unique program that will equip students with the data management, manipulation, analysis, and communication skills that will allow them to contribute to designing, understanding, and implementing public health efforts in the future. So this is a brand new program that we are just starting to admit students for fall 2022. So just some stats on our school. So we represent students from all across the country and around the world. We have great funding, national funding in our research opportunities, and our faculty are well funded as well. We have many firsts. So I mentioned our new MPH in data science. So that's a first epidemiology MPH or a PhD, first Masters of Healthcare Administration program, and maternal and child health program. And so I echo a lot of the other things in terms of the application requirements, and I'd love to talk to you more about that in our breakout session. But big thing that everybody's talking about, GRE is not required also for the University of Minnesota School of Public Health. And I'd like to go further. It's not just not required, it's not accepted. So we won't be considering any GRE scores, current or past, in our evaluation process. So they're not a part of our evaluation factors. And so that's it. Again, I'd love to talk to any of you about your interest in the School of Public Health at Minnesota, about the state, the university, and opportunities or the process. You see here on the screen my email, and I'll be happy to put that in the chat as well. So I'm going to turn it over to, last but not least, Sherry at the University of Toledo.
Okay, so I am Sherry Mills, and if I can get this to present. Come on. I am the program director at the University of Toledo Master of Public Health Program. So unlike everybody else who has presented, we are an MPH only. We're accredited as a program and not as a school. So my contact information, as I said, I'm the director of a program and the professor within our School of Population Health. So I provided my emails and I will put them in the chat of our breakout room as well. So you can contact me directly at cheryl.mills@utoledo.edu or a general public health at utoledo.edu. We are a CEF accredited program. We have been accredited since 1997, originally as Northwest Ohio Consortium of Public Health. We have been the University of Toledo MPH program since January 1st of 2019. We offer 5 majors listed here. Our generalist is going fully online, effective with the spring 2022 admissions. All other majors have face-to-face courses, but students in those programs are welcome to take the online versions of the course. It's just not all their courses are available online. Our program delivery is for the face-to-face classes. They are only offered in the evenings. Classes do not begin before 5 p.m. They meet once a week or less, depending on the course itself. We have a 300-hour internship required. And because so many of our students are working, we can spread the internship over 3 semesters, and we are open to the students being able to do their internship anywhere in the world. So we do have some financial assistance available. We offer 4 internally funded graduate assistantships. And currently we have about 5 to 8 that are externally funded that either work with the Toledo-Lucas County Department of Health or our Northwest Ohio, the Hospital Council of Northwest Ohio also hire our students on a GA basis. And what's nice about those positions is that, especially with the Hospital Council, those people are often then employed directly after they finish their program. So giving you links to our program website and our admission requirements, we do, as with other programs, require a 3.0. For anybody graduating from a US accredited institution, a GRE is not required. At this point, we are still requiring a GRE only for students graduating from international institutions. However, that is potentially changing and we're looking at that. We admit for both spring and fall, and we don't really have deadlines. We will process fall admissions basically up until SOFIS closes. And for spring, we'll do it pretty much up until a week and a half prior to the start of spring semester in January. So we will continue to process as long as we have applications there. And we do not cap our admissions. So as long as you meet our admission requirements, we will admit you into our program. Our program generally goes 4 to 6 semesters if you're going full-time, or about 3 years if you go part-time. We have many opportunities for our students to participate. The university itself has over 450 student organizations. And our public health program has a public health student organization that we share with our Master of Science in Occupational Health students, our industrial hygiene students. We have started an MPH Student Advisory Committee full of students, and then we have Eta Sigma Gamma that students can be a part of, which is a health education honor society that many of our MPH students have been part of. Toledo is a great place to live. This is a picture of our Toledo Museum of Art, which is a world-renowned museum. We have had exhibitions here that Toledo is the only place it has gone. There's lots to do. It's easy to get around. We can say that it pretty much takes 20 minutes to get anywhere. In addition to the museum, we have our own symphony. We have the Toledo Mud Hens. So if you ever watched MASH, you learned that Klinger was from Toledo. And we'll talk about the Mud Hens. They actually exist. It's a AAA baseball club who just won their division this summer. We have a Toledo Walleye, which is our ECHL hockey team. And where the Walleye play, we actually are able to get anybody who would perform at a smaller venue of 10,000 people. We had Tim McGraw and Faith Hill before the pandemic will come to Toledo. And this summer, we just hosted the Solheim Cup. So if anybody's into golf, you will understand that that is the women's version of the men's Ryder Cup. So we had many people from around the world who could actually come attend that event earlier in September. So please come to our breakout room and I can answer any specific questions at that point. Thank you.
Thanks to all of our wonderful presenters. I'm sure that you all have learned a lot. I definitely got some great information from that. Now I definitely want to open it up for you all to see if you have any questions. Some of you are great and added some questions to the chat. We're going to just do a great Q&A session for you all, answer some admissions questions, some programs questions, and some more good stuff. So to kick us off, I'll start with the question that was left in the chat, which is, what are some ways to get financial aid, and is the FAFSA necessary for that?
I can say at Toledo that a FAFSA is not required to get the financial aid through the program, any of our graduate assistants. We don't look at a FAFSA. Obviously, if you need federal financial aid, yes, a FAFSA is required, but to get a graduate assistantship, it is not.
Yeah, and I'd like to add that the term financial aid can mean several things to different people. So financial aid can be broken down into scholarships and fellowships, right? A lot of those are merit-based. And then there's financial aid that are loans, usually federal financial loans, but also personal loans. And so for federal financial loans, yes, you need to fill out a FAFSA. But in order to qualify for scholarships, especially at CUNY School of Public Health, you do not need a FAFSA because we do not look at your financial information. We look at your entire SOFAS application to see if you qualify because it's a merit-based aid.
So at the University at Albany, we're very similar, although we do have a few scholarships that include financial need as one of the criteria. So if you want to be considered for one of those, and we have those clearly listed out on our website, you would need to submit the FAFSA because it could be a determining factor in the end for a few of the scholarships.
I think if I could add on to that, just I think a lot of schools these days will consider a student's application for the not only admissions but scholarships, as Margaret was saying too. So when you're going into the application process, go with it in the mindset that you're submitting the information, your statements, and all those things, not only for admission but to be competitive for scholarships. So you want to make sure that you are touching on points that would be maybe appealing to some more specific scholarships. So if you are able to access any sort of list from schools that may indicate, endowed scholarships that you might connect with, you might want to make sure that you are highlighting that in your application or communicating that in some way, so that way they can easily more pair you up with that specific scholarship opportunity.
This is some great answers. We do have a follow-up question to that, which is which FAFSA would you fill out if you're applying for fall 22? Just help with the timing.
Well, you want to wait till the new one comes out, I would, so that, and depending upon the deadline for the program that you're applying to, I believe they open up now in October. There's, earlier than it used to be. You used to have to wait till January. So, I would encourage students to do it, to line up with their program deadline application. So for example, for us, January 15th is our priority deadline. So we would encourage you to submit your FAFSA before January 15th so we can coordinate with the financial aid office to see where that need matches, so that they have your financial need to provide to us.
And just if I can add on to just a clarification with the FAFSA, because they have been making it open in October, but then you still have to be prepared to provide any sort of updates once January hits and you get your current year's tax return information. So so October is really great. I think that tends a lot to also support undergraduate students that need that get those packages much earlier than I think a lot of graduate professional schools do. But if a scholarship requires the FAFSA, it might be helpful to have that initial information, I'm sure. So just to be clear that, if you do it in October, you'll probably still have to maybe make an update if something drastically changes in January.
Yeah, I mean, that's true, but I believe that it's now they're doing a year back. It's not the direct, if I recall correctly. And I'm saying that also from my own kids' experience, that they now do it a further look back period. But I think you're right, Dan, that you may need to provide some updated information.
Yeah, that's what I remember. I graduated undergrad in 2019, so it's pretty fresh in my mind.
Right.
But I do remember that there was that period of just like updating information if much had changed. So
yeah,
definitely read a lot of information and emails that you get regarding that. So you don't want to miss any caveats with that one. So we have another question that's asking, what does the application process for a graduate assistantship look like? Or what can it look like?
Yeah, I mean, I think different programs have different, with us, it's basically a job application. We make a limited number of assistantships available prior to the decision date of April 15th, but you basically apply to it like a job. With your resume and your interest, and there's often a skill set. That's how we do it here, because graduate assistants are really primary support people for us, but other programs may have a different process. So
that's great.
Yeah, for UIC, we do offer some, especially at the doctoral level. It could be offered with an offer of admission. The master's level becomes much more common in the second semester and second year after at the school start networking with faculty, and they're hired directly by faculty. So you apply that way, and a lot of them are found through networking with professors and advisors as you're going through the program.
I'll kind of jump in on that. So just reiterating, it's kind of like applying to a job, but there was another question here about contacting professors as well. Like in the College of Public Health at East Tennessee State University, some of our professors in research do withhold the listing of their GA, and they get people that contact them that are interested in their research first. But generally speaking, in the link I gave in our graduate studies, we have a list of GA positions that you apply to like a job.
Sorry about that. Those are really helpful answers. Thank you all. So I guess we'll pivot a little bit while we see if you all have any questions you'd like to enter in the chat for our presenters to answer. But a question that people often ask is kind of, what are the main differences between getting a master's degree versus a doctoral degree?
the depth of what you're doing, so the time you get to spend. So with a master's degree, and there's a difference between the MPH and the MS. So the MPH is a practice-based degree. You don't have to, it's not research-based, or you're doing experiential, whether it's an internship or it's a course, community activity or co-curricular. With a master's degree, you're going to do a research project, basically. Some require a field placement, and it's a fairly narrow project or problem that you're working on. When you get to the doctoral level, you have a much bigger problem. You may have 3 specific aims. You know, you're going to be much more in depth about what you're doing. And you're really going to become the expert in that field, because you're supposed to, it's supposed to result in original, significant, creative work. Whereas, and really contribute to the body of knowledge, whereas the master's degree is a much more narrower, shorter term kind of project.
That was very helpful and thorough answer. Thank you. We did get a question about SOFAs, which is great, well, we got 2 questions. We'll start with this first one, which is, what are some reasons that you should submit your application before the deadline and give some wiggle room? I'm sure there are quite a few answers that can, fill in that space, but what are some main reasons that you would suggest people do that?
I would say in case you have delays with the references coming in, any of the materials coming in, we at the University at Albany will send you reminders. Hey, you got your application, but we're missing a letter or this and that gives you more time to then go out and contact and follow up in case there's some problems with it. Plus, frame of mind, you got it done. So.
I think that's a really good summary for reasons to do it. Getting it out the way and making sure you get everything in are two good things. You don't want to be stressed that last week for your transcripts to be sent over. So another question related to SOFIS is more about the application, and it is, what format do you want the resume? Do you want it in a one page, or do you want like something more fleshed out detailing what you're doing at the job?
I don't want to jump in on everything. So.
From Toledo's viewpoint, we don't really have specifics. We're just looking for whatever you can put together. So we've got some very nice one-page ones, and then we also have medical residents, so we get 30 or 40-page ones. So whatever is where you're at, we just want to see a resume that you've organized yourself enough that you can put down what it is that you have done in a logical manner that we can see without any typos and spelling errors.
I would like to add to that, being on an admissions committee, I'm also from University of Toledo as Dr. Mills. I've been serving on admissions committee, and I think one thing I want students to understand when you're applying for graduate school is you are past that stage of you have to fit your resume into one page. It's at a stage it has to be as long as it needs to be. And MPH being a practitioner's degree, the more you provide details about your experience, the employers or even programs will be able to see if you are a good match or not. The depth of one experience might be very different from the other experience. So it helps them to understand the better fit, even for while applying for jobs.
I would like to go back and comment though on that, when should I submit my application? And one of the things that, at least from our perspective, is that now when you you're an in-progress application, you know, we can actually start seeing what you're submitting to, and you can go ahead and submit that application before everything is in. So as long as all of your demographic is in, all your personal information in, you've added in all of your coursework, you know, you've got that electronic transcript in so we can see what your courses are, you can go ahead and submit that and then be done. And then some of your materials are going to come in after the fact. Your transcripts are going to come in after the fact. Your letters are going to come in after the fact. So you don't have to wait until it's complete like that to do it. You go ahead and submit, and then you can kind of sit back and relax about it. And although SOFA says that it takes 4 weeks to verify your application, they're actually much more efficient than that. And so it might take a few weeks for your application to be verified, which means that we can see your GPA calculated. But at least if you've submitted, we can still see it. We can look at those grades and we can start knowing, you know, and some schools may start pre-reviewing and waiting for things in. So it's just beneficial to get all of that in as soon as you can.
I think those are great. I don't know if anyone else had to add either about that or the question that we had before about the resume.
I would say for New York Medical College, just kind of piggybacking on what has been said already, you know, because we look at the applications as a whole in terms of the resume, I think, you know, the detailed oriented ones are usually appreciated, because we really would get a good sense combining that with the letters of recommendation that we might get from those places, and also the personal statement. We really get a good feel as to the work experience that you do have in the public health field, and the wealth of things that you might have done at a certain position. So I would agree with what has been said already, that we really want to get to know you, and that's a good way to get to know you and what you've done.
I would maybe just add on to, sorry, you know, there's the resume component itself that's, you know, an attachment in your application, but within SOFIS, there's also, SOFIS is a really large process in terms of the application, and there are sections for activities and experiences and things like that. So some schools and some programs within even our school, for instance, you know, utilize that area, and some don't utilize it as much, but that might be also an area to think about when you're doing it, when you're building out your resume. What can you populate then into those sections of SOFIS that would be reportable and easy for a program to utilize as well. So, because sometimes it does feel redundant. Just kind of keep that in mind when you're approaching the process.
Dan and Nick's comments make me think, so I guess what is the main purpose of the personal statement, and how does that interact with the rest of the application, I guess, especially the resume portion?
I think really for my perspective is a personal statement is really your voice in the application process. For many of our programs, I would say most of our programs, with the exception of the MHA, we don't do interviews. So the personal statement is really a great way to get a sense of a person's personality in written narrative form, understand kind of how they can present themselves in a clear, direct, and concise way. Their writing, it's essentially also a writing sample. So you really want to approach the personal statement in that way. And for me, when I give a lot of advice, especially since we can take out the GRE as one of the evaluating tools, personal statements are a large component to the review process. Because when I've looked at applications in the past, I tend to direct myself to the personal statement more often than say the resume, because then I can see in the student's own words, what are they genuinely interested in, and what are their motivations and things like that, and what's their experience leading up to this, what do they consider to be important. So I think that's why I put more emphasis in the personal statement of the application components myself.
This is helpful. So we have time for maybe one or two more questions. I'm sure this is one that is on many people's minds, which is any recommendations on figuring out which concentration is best suited for you, especially if you have more than one or maybe two programs that you're really torn between. Is it possible to maybe even apply for both of those?
So at the CUNY School of Public Health, you can apply to as many as 5 programs at the same time. That's definitely possible. But what we encourage you to do is to attend our program specific information sessions to learn more about each program. Those are led by usually our department chairs or faculty within those specific programs. And then we also have current students or alumni in those sessions. So you really get a very detailed view of each program during each of those sessions. Go online to all the program pages, all the school online pages, and read more about those programs as well. And then reach out to faculty. We definitely encourage students to reach out to our faculty and ask them questions.
At Toledo, you can only apply to one of the majors. However, we are set up that it is very easy if once you start the program, you decide this isn't a one for me, that you can change majors, or you can, which we don't have set up in SOFIS, but you can do dual majors. Okay, I like this one and that one. I want to do 2 together. Well, we don't have it set up in SOFIS because that would mean we would have 15 applications every semester, and decided, no, we don't really want to do that. But once you get into the university, we can make it very easy for somebody who wants to do both and explain how they can do both or switch from one to the other without losing credit hours or minimal credit hours.
The University at Albany is similar. You have to apply to one, but we also have these certificates that you can add on. So you could focus in social behavior and community health, and then also complete a certificate in global health or maternal and child health, one of these other areas, so that you're basically getting 2 in 1. And because you do so much internship with us, you're going to do 2 internships. You can do an internship in each of those areas too. But we also have the ability to easily switch between some of the concentrations.
I would add on to that, just look at the schools that you're interested in, what kind of interdisciplinary opportunities there are, whether formal or not. So you don't necessarily, if you have an interest in 2 areas, you don't necessarily need to fully do both degrees or have be as in depth as you think, because there's a lot of opportunities in both. Naturally through course selection and things like that. So whether it's through a certificate or graduate minors or establish formal dual degrees, or just literally saying, hey, I'm interested in this, this one course, can I take that as an elective? There are opportunities for that, and I think so just investigate with each school what their ability is. Especially sometimes programs might have a little bit more densely tight course requirements within their degree programs, so you might not have as much wiggle room. So it's a good question to have, but can maybe help ease a little bit of that anxiety of which one to choose from, because you can maybe have best of both worlds in a digestible, manageable way. So.
Well, thank all of our presenters for their wonderful answers. They're very thoughtful and informative, and they're great presentations. I'm going to just share one more thing with you all before we go ahead and split out into our breakout room so you can get even more wonderful information. So on the screen, you'll see some upcoming events that we're having. Up until November, we will have a mini fair on Tuesdays and Thursdays for you all, featuring more ASPPH member schools who will give more wonderful presentations that are wonderfully informative.